All right, so we're going to move to the lightning round here because we now have 7 questions. So, Tom, assuming your device is already, actually no, we're going to give this to Richard because your device isn't 510 cleared approved, so I don't want to put you in a bad position. But assuming your device is already 510K approved, can you talk about any regulatory landmines with transferring patient data wirelessly?
Well, as part of getting our 510K approval, because we wanted the end-to-end, the device itself, the mobile application, and the portal, FDA wanted us to transmit, I think it was 10,000 data points. 10,000 data points on a variety of meters, 10,000 data points into the mobile application, 10,000 data points to the portal, and make sure that those were all exactly the same. So that was definitely a potential landmine. Luckily, we did all 10,000. If there was one bad, I don't know. I think we would have gone back around.
Yeah, and there's a lot of concern about store and forward data, and then how do you make sure that the last piece of data that was on the whatever the device people are reading at, if there is no longer getting current readings, how do they know that that's going?
Communication channels aren't going to be 100%.
Right. Okay, Tom. What role will wireless technology play in eliminating fraud and abuse in the healthcare system, and is that a good selling point for bringing new products to market?
Boy, that's a tough one. How is wireless technology going to diminish fraud and abuse?
And is that a worthwhile selling point?
Yeah, well, I mean, it certainly would be an interesting business model. I imagine somebody would pay for it or a way to prove that you could back to it. I don't think that there's necessarily a direct link in that regard. I think that there's obviously an implied transparency that we're trying, actually the government, the ONC, for example, the Office of National Coordinator, is trying to set up with a national network, information network for healthcare, that presumably, because there in time will be a network of networks and this free exchange of patient information, whether it's from a patient health record or an EMR from various hospitals, that I suppose there's a possibility that type of transparency may discourage the use of medical information for fraudulent billing and that sort of thing.
But Tom, by virtue of the fact that it doesn't strike you as immediate, I would say this probably doesn't sound like the best way to do it. Question to the group. What are the new non-traditional players in the distribution market?
Well, I'm going to just take a real quick
Please, and please do.
This is one of the more fascinating aspects of this era that we're moving into, is that there's really a convergence of 3 industries going on right now. A lot of people, I think everybody recognizes the fact that the telecoms and the medical industry are coming together, but there's a third, which is the consumer industry, that would be represented by companies like Google, for example, or Microsoft, Intel. That's a really significant event, and it poses some wonderful opportunities because none of the industries are necessarily expert in the other area. And so there's tremendous opportunity for partnering. There's also a tremendous opportunity for deal making. So I think it's going to be a really rich new landscape for investors down the road. And it's also a very rich opportunity for technology access that doesn't exist right now. One final comment, I think if I were to bet, I think that the landscape in the medical field, medical device world, particularly in patient monitoring, is going to look very different in 5 to 15 years. And a lot of the traditional players, they may still be there, but they're not necessarily going to be in the front of the line. There may, in fact, be a lot of companies from these other industries, for example, that choose to move in with even more contemporary technology and become leaders in the area of wireless medicine.
Yeah, there's an app for that.
There's an app for that. Yeah, and Tom, just another person's perspective, I actually think that wireless health is a precursor to digitization of medicine. And whether it's, if anyone hasn't heard Eric Topol speak, it's worth listening to Eric kind of combine how do you begin to look at genomics in terms of looking at understanding biology and then beginning to look at monitoring physiology through wireless, and the convergence of all that data on an individual is just going to fundamentally change medicine. I mean, you're going to get into something, Tom, with continuously monitoring blood pressure. Well, to be honest with you, most people, unless you're crazy, are having, or you're really sick, you're more or less having a blood pressure reading, on an appointment basis, in the and if your appointment was at 10 o'clock, your blood pressure would be one thing. If your appointment was at 3 o'clock on the same day, it would be something else. And they're making decisions off a very narrow sample base, so we just got to think through that. Jarrin, if NIH, there's actually 3 questions around NIH. Are they, if anyone else knows the answer, please jump in, but is NIH going to play any role long-term in wireless?
Yeah, no, absolutely. It's funny, yesterday the NIH released its Medline Plus, it's, I think, a quarterly newsletter, and the lead story in it was Dr. Francis Collins, who's the director of the NIH, speaking about mHealth and wireless. And in the article, he states that because of our stimulus funding, they were able to fund, I believe, about 150 awards within the 27 different institutes within the NIH, specific to mobile health wireless projects, which I think is fantastic, because if you look back about 5 years ago, 10 years ago, that wouldn't have even existed. Going forward, or actually I'll speak about the past, the present, and going forward. In the past year and a half alone, the NIH has had numerous small conferences and invitations to the industry to come and speak about reducing barriers to healthcare via mHealth. I know that the Office of Behavioral Social Science Research has been very proactively involved in working with the NIH Foundation to create things like the mHealth Summit, which was a huge success. This being the second year that they had it, Bill Gates spoke, as well as Ted Turner and a number of other dignitaries, including folks from the government. Currently, I know that the NIH is working on things like establishing a summer institute, which some partners should be announced shortly on that. Again, focus on mHealth, reducing adherence issues by using mHealth, and coming out with favorable outcomes, and also the science and technology of medicine and wireless. So I really do see NIH as playing a very understated role, because not many people know how proactively they are involved. They're also working with so many other facets within HHS to really drive mHealth. They work intimately with the CDC. The CDC has been able to put online, I believe, the National Library of Medicine catalog. The CDC had a pilot project for H1N1 via text messaging. You don't really hear about these things, but they're really available to the millions of 280 million subscribers, wireless subscribers in the U.S. So I think it's really a very compelling story coming from the NIH.
Yeah, and they now have a director of corporate outreach as well, which is interesting. I know she is going to be, as part of the Health 2.0 conference, she's going to be spending a week, and I'll mangle her name if I offered it.